I remember the first time I saw a 32-year-old come into the emergency room with a heart attack. It was a Tuesday morning, and honestly, my initial reaction was disbelief. This person looked healthy, active, the kind of individual you'd see at a coffee shop working on their laptop, maybe heading to the gym later. But the EKG didn't lie, and neither did the blood work. That case stayed with me because it challenged everything I thought I knew about cardiac events in younger populations. For decades, we've operated under the assumption that heart attacks were primarily a concern for older adults, particularly those over 55 or 60. The statistics supported this view, and our medical training reinforced it. But something has been shifting, and it's worth paying attention to how often this comes up. What strikes me most about these cases is how they develop without the traditional warning signs we've been trained to recognize. When we think about heart disease progression, we typically envision a gradual process. Years of poor diet, lack of exercise, maybe a family history that slowly manifests over time. In older patients, there's often a clear timeline. High blood pressure diagnosed in their 40s, cholesterol issues emerging in their 50s, perhaps some weight gain and stress accumulation. But in these younger cases, the trajectory can look completely different. I've seen individuals who exercise regularly, maintain what appears to be a healthy weight, and have no obvious risk factors suddenly present with significant cardiac events. The traditional risk assessment tools we use don't always capture what's happening here, and that creates a diagnostic challenge that extends beyond just individual cases. The lifestyle factors affecting this generation are unlike anything we've seen before. The stress patterns are different, not necessarily more intense than previous generations, but sustained in ways that may have cardiovascular implications. There's the constant connectivity, the economic pressures that are unique to this demographic, the career demands that often involve long hours and irregular schedules. Sleep patterns have changed dramatically. I regularly see patients in their 20s and 30s who describe sleep as something they try to fit in rather than prioritize. The relationship between sleep deprivation and cardiovascular health is complex, but chronic sleep restriction can affect blood pressure regulation, stress hormone levels, and inflammation markers in ways that may contribute to cardiac risk. Then there's the nutritional landscape. While there's more awareness about healthy eating than ever before, the practical reality for many younger adults involves processed foods, irregular meal timing, and eating patterns that can affect metabolic health. The convenience food industry has evolved to offer options that appear healthy but may not provide the cardiovascular benefits of traditional dietary approaches. Physical activity presents an interesting paradox. Many younger adults are either very active or quite sedentary, with less middle ground than we might see in other age groups. Those who exercise often push themselves intensely, sometimes without adequate recovery or attention to overall cardiovascular conditioning. Others live largely sedentary lifestyles with work and social activities that involve minimal physical movement. What makes this particularly concerning is how these risk factors can compound without obvious symptoms. Unlike older adults who may notice gradual changes in their exercise tolerance or energy levels, younger individuals often maintain their functional capacity even as cardiovascular risk accumulates. They adapt to stress, push through fatigue, and may not recognize early warning signs. The social and economic factors can't be overlooked either. This generation faces financial pressures that can affect healthcare access and lifestyle choices. Many are dealing with student debt, housing costs, and career instability that can influence everything from food choices to stress management to whether they seek preventive medical care. There's also a psychological component to consider. Younger adults often feel invulnerable to serious health problems, which can lead to delayed medical attention when symptoms do occur. A 30-year-old experiencing chest discomfort might attribute it to work stress or poor sleep, rather than considering cardiac causes. This is where a lot of confusion usually starts. From my clinical perspective, I've noticed that these cases often don't fit our traditional diagnostic patterns. The chest pain may be atypical, the risk factors may be subtle, and the patient presentation can be challenging to interpret. Standard screening tools and risk calculators often underestimate the possibility of cardiac events in this age group. The diagnostic workup itself can be complicated. When a younger person comes in with chest pain, we're naturally inclined to consider other causes first: musculoskeletal problems, anxiety, gastroesophageal issues. While these are statistically more likely, this approach can sometimes delay recognition of actual cardiac events. In general medical practice, we're seeing patterns that suggest this isn't just an isolated phenomenon. Emergency departments across the country are reporting similar trends, and the cardiology literature is beginning to address what appears to be a real increase in cardiac events among younger adults. The challenge is determining which factors are truly causative versus coincidental. Modern life involves many variables that previous generations didn't face: different stress patterns, environmental exposures, dietary changes, sleep disruption, and social pressures. Sorting out which of these contribute meaningfully to cardiovascular risk requires careful analysis. Some research suggests that the mechanisms of heart disease in younger adults may be different from those in older populations. While traditional atherosclerotic disease typically develops over decades, younger patients may experience cardiac events through different pathways, perhaps involving arterial spasm, inflammation, or other processes that aren't captured by conventional risk assessment. The role of genetics is also being re-examined. While family history has always been a recognized risk factor, we're learning more about how genetic predisposition interacts with modern environmental factors. Some individuals may be particularly susceptible to cardiovascular stress in ways that weren't apparent in previous generations living under different conditions. This is something many people don't really think about, but the interaction between individual physiology and environmental pressures can create vulnerabilities that aren't immediately obvious. A person might have a genetic makeup that handles traditional cardiovascular stressors well, but struggles with the specific combination of factors present in contemporary life. Treatment approaches for younger patients with cardiac events also present unique considerations. The medications and interventions developed primarily for older adults may not always be optimal for this population. Recovery patterns can be different, and the long-term management strategies need to account for the fact that these individuals may live with cardiovascular disease for many decades. The psychological impact of a cardiac event at a young age can be profound. Unlike older adults who may view heart problems as an expected part of aging, younger patients often experience significant anxiety about their future health, career implications, and lifestyle limitations. This emotional component can actually affect recovery and long-term cardiovascular health. Prevention strategies also need to be reconsidered for this demographic. Traditional approaches focused on diet and exercise, while still important, may not address all the relevant risk factors. Sleep hygiene, stress management, work-life balance, and social support systems may play more prominent roles in cardiovascular health for younger adults. There are different views on whether we're seeing a true increase in cardiac events among younger adults or simply better recognition and reporting. Some of the apparent increase might reflect improved diagnostic capabilities and more aggressive evaluation of younger patients with cardiac symptoms. Emergency medicine has evolved to have a lower threshold for cardiac workup across all age groups. However, the patterns I observe in practice suggest that environmental and lifestyle factors unique to this generation are playing a role. The combination of chronic stress, sleep disruption, dietary changes, and social pressures creates a cardiovascular risk profile that may be different from what we've seen historically. From a clinical perspective, this means we need to adjust our approach to cardiovascular risk assessment in younger adults. The traditional focus on age, gender, family history, and basic metabolic parameters may not capture the full picture. We're learning to pay more attention to stress patterns, sleep quality, social support, and other factors that might influence cardiac health. The challenge is balancing appropriate vigilance with the risk of creating unnecessary anxiety. Most younger adults will not experience cardiac events, and we don't want to promote excessive worry about cardiovascular health. But we also need to ensure that legitimate symptoms are evaluated properly and that preventive strategies address the actual risk factors this generation faces. Medical education is adapting to include more emphasis on cardiovascular disease in younger populations. Emergency medicine training now includes greater awareness of atypical presentations in this age group, and primary care providers are developing new approaches to risk assessment and prevention. The research community is working to better understand the mechanisms underlying cardiac events in younger adults. Studies are examining everything from inflammatory markers to stress hormones to sleep patterns to social determinants of health. This research will hopefully lead to better prevention strategies and treatment approaches. In the meantime, what I find myself doing is maintaining a careful balance between appropriate clinical suspicion and realistic risk assessment. When younger patients present with cardiac symptoms, I try to evaluate them thoroughly without assuming that age alone rules out significant cardiac pathology. The broader implications extend beyond individual patient care. Healthcare systems need to adapt to address cardiovascular disease across all age groups. Insurance and employment policies may need to consider the reality that cardiac events can occur at younger ages. Social support systems and community health initiatives might need to address the specific stressors and risk factors affecting younger adults. This represents a shift in how we think about cardiovascular disease from primarily a disease of aging to something that can affect adults across a broader age spectrum. The causes may be different, the presentations may be atypical, and the treatment approaches may need modification, but the reality is that cardiac health is relevant for all adults. These are questions that come up a lot in real life, and honestly, we're still learning. The medical community is working to understand these trends, develop better risk assessment tools, and create prevention strategies that address the unique challenges facing younger adults in today's world. What I can say is that cardiovascular health remains important regardless of age, but the approach to maintaining that health may need to evolve to address the realities of contemporary life. Whether that involves different stress management strategies, modified approaches to work-life balance, or new ways of thinking about sleep and recovery, the goal remains the same: maintaining cardiovascular wellness throughout life. The conversation about young adults and cardiac events is ongoing, and it's one where both patients and healthcare providers are learning together. The traditional assumptions about age and cardiovascular risk are being challenged, and that challenge is leading to a more nuanced understanding of cardiac health across all life stages. Environmental factors contributing to this trend deserve consideration. Urban air quality has implications for cardiovascular health that we're beginning to understand. Pollution, allergens, and atmospheric factors may create inflammatory conditions affecting cardiac function differently than in previous generations. Technology's role is particularly complex. Digital devices have created new patterns of physical inactivity and social isolation. Computer work posture, reduced daily movement, and constant connectivity stress potentially contribute to cardiovascular risk in ways traditional assessment tools don't capture. Economic pressures facing this demographic create chronic stress. Many younger adults live with ongoing uncertainty about housing, employment, and financial security. This stress activation can affect blood pressure, heart rate variability, and inflammatory markers. Substance use patterns have evolved. Traditional smoking rates have declined, but other nicotine forms have emerged, along with different alcohol patterns and stimulant consumption. The cardiovascular effects of contemporary usage patterns aren't well understood. Dietary patterns present complexity. Processed foods marketed as healthy create misleading nutritional environments. Organic, natural, or plant-based labels don't automatically mean cardiovascular protection. The social isolation that many younger adults experience, particularly in urban environments, represents another potential risk factor. Despite being more connected than ever through digital means, many report feeling socially isolated or lacking strong community support. The relationship between social connection and cardiovascular health is well established, but the specific effects of digital versus in-person social interaction on cardiac wellness remain unclear. Workplace culture has shifted dramatically, often promoting productivity at the expense of health. The glorification of long hours, the expectation of constant availability, and the pressure to maintain multiple income streams or side projects creates a work environment that may be particularly stressful for cardiovascular health. Unlike traditional work stress that might be confined to specific hours or seasons, modern work pressure can be relentless. Sleep quality has deteriorated not just in duration, but in consistency and depth. The blue light exposure from screens, irregular work schedules, social activities that extend late into the night, and the psychological activation from social media consumption all interfere with the restorative sleep that's essential for cardiovascular recovery. Exercise habits, when they exist, often reflect extremes rather than sustainable practices. Some younger adults engage in high-intensity fitness routines that may create additional stress on the cardiovascular system, particularly when combined with other stressors. Others maintain completely sedentary lifestyles with minimal physical activity. The middle ground of moderate, consistent physical activity seems less common. The healthcare system itself presents barriers that may delay recognition of cardiac issues in younger adults. Insurance coverage may limit access to preventive care, and the cost of medical evaluation can be prohibitive. Many younger adults postpone medical attention due to financial concerns, and when they do seek care, there may be a tendency to minimize symptoms or avoid comprehensive evaluation. Mental health factors intersect with cardiovascular risk in ways that are particularly relevant for this demographic. Anxiety disorders, depression, and other mental health conditions are more openly discussed now than in previous generations, but the relationship between mental health medications, stress management, and cardiovascular wellness creates additional complexity for both patients and providers. The pharmaceutical landscape has evolved to include more medications that might affect cardiovascular health, from prescription stimulants for attention disorders to hormonal contraceptives with different risk profiles. Younger adults often take medications whose cardiovascular effects may not be fully understood when combined with contemporary lifestyle factors. Genetic testing and family history interpretation have become more sophisticated, but also more complicated. While we can identify genetic markers for cardiovascular risk more precisely than ever before, translating that information into practical prevention strategies for younger adults living in contemporary environments requires careful consideration. The interaction between autoimmune conditions and cardiovascular health is another area of growing concern. Many younger adults are diagnosed with autoimmune disorders that require medications and lifestyle modifications that can affect cardiac wellness. The intersection of immune system dysfunction, medication effects, and lifestyle factors creates a complex risk profile. Environmental toxin exposure through food, water, personal care products, and household items may play a role in cardiovascular health that we're only beginning to recognize. While individual exposures may be small, the cumulative effect of multiple low-level exposures throughout daily life could potentially contribute to cardiovascular stress. The pattern of acute stress responses has changed as well. Instead of experiencing occasional periods of high stress followed by recovery, many younger adults maintain elevated stress hormone levels due to constant low-level activation from work pressure, financial concerns, social media consumption, and global events they're aware of through continuous news cycles. Recovery and rest patterns have been fundamentally altered by the expectation of constant availability. The traditional boundaries between work time and personal time have blurred, making it difficult to achieve the psychological and physiological recovery that's essential for cardiovascular health. These observations from clinical practice suggest that cardiovascular disease in younger adults may represent a new phenomenon requiring updated approaches to prevention, diagnosis, and treatment. While we continue to research and understand these trends, the immediate need is to adapt our clinical practice to recognize and address cardiovascular risk across all age groups while remaining mindful of the unique factors affecting each generation.